This lecture is on an introduction to proteins. Proteins in blood are measured as plasma proteins or serum proteins. The three main fractions of plasma proteins are albumin, globulins, and coagulation proteins, which is mostly fibrinogen. Since proteins in serum are measured after clot formation, measurement of serum proteins does not include the coagulation proteins. Therefore, the serum protein concentrations tend to be 1 to 2 units less than the plasma protein concentration. The total protein concentration can be measured by refractometry using a refractometer, and that's what's reported on the CBC, or by a chemistry analyzer, which is reported on a serum or plasma chemistry report. Of the two methods, the chemical method is the most accurate since the refractometer measurement can be artifactually increased by some interference such as lipemia. Albumin is produced by the liver and it circulates in blood for about 2 weeks before it's cleared from the body by most metabolically active tissues. Within the blood, it acts as a carrier protein by binding various insoluble molecules and making them soluble. These insoluble substances in blood include unconjugated bilirubin, thyroid hormone, fatty acids, and various drugs. Albumin is also the major contributor to oncotic pressure, and it helps maintain water within the blood vessel and keeps it from leaking outside of the blood vessels into the tissues. And finally, albumin is a negative acute phase protein, meaning that its production is decreased during times of inflammation. The majority of globulin proteins are immunoglobulins, and they are produced from either B lymphocytes or plasma cells. However, a variety of other globulin proteins are produced by the liver. Immunoglobulins are a type of delayed phase proteins, meaning that their production is increased during times of chronic inflammation. However, most of the non-immunoglobulin proteins are positive acute phase proteins, and that means that they increase early in the inflammatory process, similar to fibrinogen. Increases in immunoglobulins during times of chronic antigenic stimulation can be mild to marked, but increases in other globulins in the acute phase response tends to just be a mild increase. At the end of their circulating lifespans, globulin proteins are then cleared by the tissue macrophages.